So I'm going to try and answer as many questions as possible in the short time that we have. I've done this before and it's actually worked really well. There's always so many questions that people have, and it's really sad actually, because so many of them they should be able to answer very easily. But as many of you know, there's a huge amount of information on various websites, on social media, and not all of it's accurate. And it's really important that anything we do is as evidence-based as possible. Often in menopause and hormone care, and also in anything related to women, the evidence is really limited. And that's because the studies haven't all been done. But actually, a lot of this is common sense. I've spent a lot of time in the past talking about the role of hormones in our bodies. And so we have to remember a lot of what we're talking about is just natural physiology. It's not the same as talking about drugs that are made and manufactured and are not natural substances. So I've downloaded as many questions as I could, there were loads, onto my laptop. So I'm going to read through them and see how much we can do. So they're all quite chaotic. I haven't ordered them, so they're on different themes. So the first question is, I was on HRT for 4 years, and then I developed breast cancer, and I've also got adenomyosis. So breast cancer will occur whether women take HRT or not. Actually, around 1 in 7 women now do develop breast cancer. The commonest type is an estrogen receptor positive breast cancer, which means it's got estrogen receptors on it. Doesn't mean it's been caused by estrogen though. I have done a whole YouTube about menopause after having breast cancer and treatment choices, and a lot of this is very uncertain because we don't have evidence. So it is worth also listening to some podcasts that I've done on this topic, especially one with Dr. Sarah Glynn. Can I take progesterone and estrogen every day, or should there be a day off? Usually people take it continually. I have heard of some people where they have a pause, especially if their progesterone. Progesterone is actually licensed for 25 out of 28 days, even when it's taken continuously. But most people actually just take it the same time every evening. Sometimes people talk about resetting the receptors and having a few days off, and that's fine as well. And obviously the progesterone we sometimes give cyclically, so 2 out of 4 weeks, so then people have their periods. So it's a very individual decision, but normally with the estrogen and testosterone we don't have a break. My GP says I can't have testosterone as it's not approved for women on the formulary. Why? So I've also done a YouTube about testosterone, but testosterone isn't licensed for women. The only country it's actually licensed for women is Australia, but I speak to a lot of Australian women who can't access it over there either. Testosterone is a natural hormone. We have licensed preparation that's available for men in the UK, and we are allowed to prescribe things off-label or off-license if we know that there isn't a licensed alternative. Also in the NHS, many people do prescribe testosterone off licence, but some GPs it's still not on their formulary. And I've spoken to quite a few GPs who've told me they're not allowed to prescribe testosterone, which doesn't actually make sense. Sometimes people feel that they haven't got enough confidence or had enough training to start testosterone. So quite a few people come to our clinic to be started on testosterone, stabilised on the right dose for them, and then their GP takes over the prescribing afterwards. So there's always options. Testosterone can be very good to improve libido, but actually more importantly it can improve mood, energy, concentration, stamina, can help with sleep, it can help reduce muscle and joint pains. So it is important to consider for many people. Surgical menopause, no notable symptoms. When can I expect them after surgery? Really impossible to answer actually. It depends on your age as well. And actually menopause isn't just about symptoms. If you're young and had a surgical menopause, so under the age of 51, the recommendations are the majority of those women should be considered for HRT. And even older women, you can still continue as long as benefits outweigh any risks. Can the contraception pill be an effective form of HRT? So HRT is the best way of taking it is the natural hormones, so estradiol, progesterone, testosterone, and usually we prescribe them separately so you can have the right dose and type for you. If you have contraception, it might help with some symptoms, but it's synthetic. It's been chemically altered, so you're not going to have the same biological benefits. We know that people taking the pill, for example, aren't likely to have the same heart, bone and brain benefits than people taking natural hormones. And there are risks with the synthetic hormones, a small risk of clot, for example, a small risk of heart disease, and the risk of clot and heart disease increases as we age anyway. So always in medicine, if there's a safer alternative, we usually recommend that. So it would be worth talking about having an alternative. I take Everell 100 patches. Is it worth trying the gel to see if I absorb that better? So absorption's a real thing, isn't it? Because a lot of people are worried about the dosing of hormones, but actually it's all about penetrance and absorption through the skin of the gel or the patches, which are the two main ways that we give estrogen through the skin. People's skin type is different. Our skin is a barrier. So many people find it hard to absorb the adequate amount through the skin. If you find that you're on, for example, 100 microgram Everall like this lady, your estradiol level is low and you're still getting symptoms, then one of the things would be to consider changing to the gel, and you might find the gel absorbs better. There are two different types of gel in the UK. There's one called Estrogel and one called Sandrina. The one called Sandrina is slightly thicker and more viscous, so some people find that's better absorbed. So it's definitely worth speaking to someone about having the optimal type of hormone for you. I'm on HRT plus testosterone, but for the last 6 weeks suffering from intolerable insomnia. Now, poor sleep is a very, very common symptom of menopause and perimenopause. I always say to patients, let's optimise your hormones and then see what else is left. And so it might be related to your hormones. It's important to make sure you're on the right dose of estradiol and testosterone. You haven't said whether you're on progesterone as well, because progesterone can help with sleep too. Often we'll do estradiol and testosterone levels, which are a guide to see how the amount's absorbed and whether the dose needs changing. Many people take a supplement like magnesium, which can help with sleep, and obviously there's lots of other reasons why people don't sleep as well. Can I use vaginal estrogen? I'm also using HRT. Yeah, I've done an Instagram live about genitourinary syndrome of the menopause, so symptoms of vaginal dryness, soreness, urinary tract symptoms. They can really improve with using vaginal estrogen or vaginal DHEA. Progesterone is the other name, can be very effective. And about 20% of people who use systemic HRT still need to use vaginal hormones as well, and it's absolutely fine. Does the Mirena coil help with perimenopause, or does it make it worse? So the Mirena coil is a synthetic type of progesterone, and it just works on the womb. It helps the womb to be thin, so it means that the womb doesn't build up if people take estrogen as part of their HRT. It doesn't work really systemically in the body, and I say really because some people find that it does and they get side effects with it, but it's not the same as natural progesterone. So increasingly we are giving people natural progesterone with the Mirena coil, because a lot of women benefit from having progesterone as well. What can you do about itchy arms? Would you need to increase the HRT patch? So dry, itchy skin, very common symptom of perimenopause and menopause, and that's because we have receptors for estradiol, progesterone, testosterone on the skin as well. So if you are on HRT and you're getting skin changes, then obviously there's lots of reasons why you might get dry or itchy skin, but it's worth just making sure that your hormones are optimised, because it often does improve. I'm using estrogel, but sometimes forget to put it on. Can I use patches instead? Of course, it's a personal choice. In the clinic, we offer people a choice, and sometimes people find that they think they want the patch and then they find that it doesn't stick on very well, or they can't remember to change it twice a week and they prefer the gel, or vice versa. So of course you're allowed to change your mind. Are hormonal migraines inevitable in perimenopause? They're not inevitable, but if someone has a hormonal migraine, often the migraines are worse before periods when hormone levels really fluctuate and reduce. In the perimenopause, our hormones are going up and down, so this yo-yo level of hormones can trigger migraines in a lot of people. And sometimes what we do is give a higher dose of estrogen to suppress that up and down sort of fluctuation of hormones, which can be very effective for people with migraine. If they're not on the right dose, migraines can still be triggered. And anecdotally, some people find that using testosterone and also progesterone can be beneficial for migraines as well. Can I take Utrogestan daily? I get awful anxiety when not taking it. Yes, people can. So some people find when they take the progesterone for 2 out of 4 weeks, they have 2 weeks where they're not feeling as well as the 2 weeks when they are taking the progesterone. So what we do in those circumstances is people can then take the progesterone every evening. The reason that we start off giving progesterone for 2 out of 4 weeks is so that people, if they still have their periods, they're less likely to get irregular or breakthrough bleeding. But often it will settle with time. And if you find it beneficial to take progesterone every day, then usually you can. I started on Vagifem 3 months ago and I'm still getting urinary tract infections. So Vagifem is a very, very low dose of estrogen used as a pessary. It's usually given 1 a day for 2 weeks, then twice a week after that. But some people need more, so some people use it every other day. Some people even use it every day. It's only 10 micrograms. They used to do a 25 microgram, but for some reason stopped it. So increasing it is still a very low dose. But increasingly, I prescribe Intrarosa, which is this DHEA, which converts to estrogen and testosterone. We've got testosterone receptors in our bladder and our urinary tract. So a lot of people find that their symptoms of urinary tract infections actually reduce when they're using progesterone as opposed to estrogen. And obviously, people taking systemic HRT, it can help as well. Do you have to come off HRT before an operation? No, if you're on the body identical hormones. So estrogen through the skin as a patch or gel, the natural progesterone, the natural testosterone do not increase the risk of clot. So therefore people can continue taking it when they're having an operation. Lots of hospitals haven't updated their policies, so they say come off if you're taking any hormones. If you're taking older types of HRT, which are synthetic, or if you're taking contraception, then your usual advice is to come off those hormones before surgery because they're associated with a risk of clot. But the natural body identical hormones are not. So it's quite safe to continue. And also just be mindful that especially estradiol can help wound healing as well, and also help you feel well. So you're more likely to recover better from your operation if you continue taking HRT. HRT and the impact on gallbladder. So tablet estrogen and the synthetic progesterone get metabolized through the liver, and so there's always a risk with gallbladder that things can worsen if you're having tablet estrogen. If you're having it through the skin, and then there isn't a risk, and so it's not a contraindication. It won't increase the risk if you're having gallbladder issues or gallstones. And actually, if you've got gallstones, taking the natural hormones will be absolutely fine. How to manage POI symptoms whilst taking HRT. So POI, premature ovarian insufficiency, is menopause at a younger age. We know from studies that some of these women need higher doses of hormones. So if you're still getting symptoms, then it's really important to see a specialist who can fully optimise your hormones, because it might be that you're not on the right dose or the right type for you. Is Testogel bioidentical? Is it safe? So the Testogel is the testosterone gel that's available for men that we can prescribe off licence in the UK. It is a body identical, so it's exactly the same preparation as testosterone that we produce ourselves. So it hasn't been chemically altered like some other testosterones. What do you do if your anxiety increases with oral Utrogestan? So Utrogestan is interesting because some people feel very relaxed and calm with it, and some people get side effects with it. It's a real marmite actually. We can use it off-label vaginally or off-license vaginally rather than orally. That way it gets absorbed as the pure progesterone through the vaginal mucosa into the bloodstream, and so some people find that that's better for them. And actually some people find using a higher dose, which sounds a bit paradoxical, of Utrogestan, or we use Cyclogest quite a lot, which is actually a pessary of progesterone. It's made for the vagina or the rectum. So a lot of people find they absorb that really well, and the dose can be increased. So if you're not having, or if you're having symptoms orally, then it's worth discussing about having it vaginally or even rectally as well. Is it too late to, at 60 or 70 to have HRT? Recently been diagnosed with osteoporosis. Absolutely not too late. No one is too old to start HRT. Especially now we've got the natural body identical hormones, so the estrogen through the skin as the patch or gel, the natural progesterone, even the natural testosterone, they can all help build bone. And so anything that's going to be beneficial for our bones is good. And HRT is actually licensed as a treatment for osteoporosis. So it is worth talking to a doctor or a healthcare professional about considering HRT when you're older as well. Can sudden weepiness be due to estrogen suddenly plummeting and affecting neurotransmitters? Yes. So our neurotransmitters don't work in isolation. They work with our estrogen, progesterone, testosterone. And so when those levels reduce or fluctuate, it can affect the way that our brain works. So people can become very irritable, very angry, but also very tearful and weepy as well. Is there anything in the new guidelines that references utilising progesterone only in early perimenopause? No, if you're talking about the NICE guidance, then no, there's very little. But there's very little in the NICE guidance about dosing and formulations, actually. It's all very general. But a lot of people notice that their progesterone declines quicker than their estrogen declines when they're perimenopausal, especially when people have PMS or PMDD. Sometimes we find just adding in the natural progesterone first is enough to improve symptoms, and then with time they need to have estrogen and maybe testosterone as well. I put on my HRT gel in the morning, then I go swimming. Should I reapply? It depends how quickly you go swimming. Usually the gel will absorb within about 20 minutes, half an hour. So if your skin is dry, then you're usually good to go and it's not going to come off when you're swimming. If you're concerned in any way, your skin is still damp from the gel, then it might be prudent to just wait until after you're swimming to apply the gel. What physical exercise do you recommend for postmenopause? Anything that's going to help, but anything that you enjoy is the most important thing, because if you enjoy doing exercise, you're more likely to continue with it. It's really important that we all have a routine or a regime that we continue to and commit to. It's so easy to think, I'm going to try and do whatever exercise and then find that it doesn't fit in with your routine or your schedule. So it doesn't really matter, but it is important to think about something that's going to help strengthen your bones and build muscle as well. Really important as we get older because of this muscle loss and bone loss that we get. Please discuss HRT and fibroids and hyperplasia of the lining of the womb. So I've talked about fibroids before, I've done a YouTube about it, and I've also done one about bleeding, so it might be worth listening to those in detail. Bleeding is one of the commonest side effects of taking HRT, but it's usually benign, meaning that it's not related to cancer. In fact, people who take continuous HRT have a lower incidence of cancer of the womb compared to people who don't take any HRT at all. And often it can be the imbalance of the hormones working together or the being on the wrong dose. Hyperplasia just means thickening of the lining of the womb. We all have it when we're younger, and that's what happens every month when we're having a build-up of our lining of the womb, which shreds when we have our periods. And so that can happen obviously when we take HRT, because again we're using natural hormones. Hyperplasia isn't the same as cancer. In a very, very small number of people, they might develop something called atypia, which then can lead to cancer. But that's going to happen in people if they take HRT or not. But it's a very, very small amount. So we don't need to be as concerned as perhaps some people are. What we always do if someone's bleeding and it hasn't settled is arrange a scan. We look at the thickness of the womb, and then we look at the dose, we look at the absorption, we look at the dose of estrogen and progesterone, and sometimes the dose needs to be altered, but sometimes people need a different type of HRT as well. But fibroids can be present whether people take HRT or not, but usually people can still take HRT if they have fibroids. For my first appointment with Newson House, should I see a doctor rather than a nurse? It's actually an individual choice. Our nurses are really qualified, they're very experienced. If there's something that they're not sure, then they have doctors who work with them in the same day, so they can always ask, and we can always, we always give feedback as well. So it really is very individualised. Obviously, if you've got a more complicated medical history, then it might be worth seeing a doctor. ADHD during perimenopause, only just being diagnosed, help. So ADHD can be more common during perimenopause as our hormone levels fluctuate in our brain. We see a lot of women in the clinic with ADHD and find that actually when they're on the right dose and type of hormones, especially with testosterone, it can make a huge difference. Testosterone is very calming on the brain and can really make a difference. Should I take HRT as I'm diagnosed with chronic migraines? As I said before, it can often help actually. Being a migraine sufferer myself, I know that taking hormones can be beneficial for a lot of women, but it's also looking holistically at other triggers for migraine as well. And actually, I've just recorded a podcast that came out, I think 2 weeks ago, about migraine, so it might be worth listening to that as well. Can HRT help with bladder frequency? Yes, it can actually. So it can help to reduce irritability of the bladder, it can help reduce incontinence, can help reduce any urinary symptoms and also urinary tract infections as well. So both systemic HRT and local vaginal hormones as well can make a difference. Can HRT give you reflux? So reflux is a very common symptom actually, and actually it often improves with the right dose and type of hormones. And in our clinic, often we find that people using testosterone, actually a lot of reflux and irritable bowel symptoms improve. So I would always optimise hormones, but obviously look at your nutrition as well, which can make a big difference as well. Is it dangerous to start estrogen 20 years after surgical menopause? No, for the same reason as I said before. Usually it's very safe, especially with the natural body identical hormones. Is there a link between HRT and thrush? I developed one. I developed thrush in my esophagus. So thrush is a type of candida. It's a yeast infection. It can occur anywhere actually. It's more common in the vagina, but it can occur in the mouth and the esophagus, the gullet as well. We often find that when people have hormones, it can improve. Many times in the past, I used to not even think about hormones and give thrush treatment, and then it's only with time and experience I've realised that some of it could be related to hormones. But you can still have thrush treatment as well as taking HRT. Can HRT improve any symptoms for people with multiple sclerosis? Now, I have spoken about this before. Our hormones are produced in our brain. They help the way that the physical nerves work, and they help the conduction. So they help build myelin, which is the conduction sheath around the nerves as well. And often in people with MS, that myelin doesn't work quite as well. And so actually having the right dose and type of estradiol, progesterone and testosterone, all three of them can be very beneficial. And I've got quite a few patients who have multiple sclerosis. They still have it, of course, and they still often need treatment, but they find that many of their symptoms can really improve or stabilise when they take hormones. So you can still have it. I've had a clot in the past in my lung and I'm scared to take HRT. What's safe? So we know that the natural estradiol through the skin, patch or gel, natural progesterone, natural testosterone don't increase risk of clot, even in people that have had a clot before or have a high risk of having a clot. So it is absolutely safe. And I've seen quite a few women who have certain clotting disorders such as antithrombin 3 or protein C or protein S deficiency, and actually their clotting markers have improved when they've been taking HRT. Some of these are a repeat, that's why I'm hesitating. Muscle nerve pain in the thighs, which hormone needs tweaking or adding? It really varies actually. So muscle and joint pains, pins and needles, especially with estradiol actually, but all three hormones can make a difference. Would vaginal estrogen help with pelvic tremors? I only take HRT through gel and orally. Possibly, but I would also consider testosterone as well, because testosterone has quite an important effect on the way that our physical nerves work. And this sort of internal tremors that people get can be related to the low hormone levels as well. I'm using vaginal estradiol cream in my ears to stop them itching. How should I do that? Well, often if you're getting itching in the ears or on the skin, it's looking systemically rather than just putting up any cream on that area. So I would consider, if you're on HRT, optimising it fully. And that's where seeing a menopause specialist can be really helpful to make sure that you're on the right dose and type of hormones. Any time limit on testosterone? I'm 57, been taking it for 2 years and dread my GP stopping it. Well, we don't have long-term data about testosterone because the studies haven't been done, but it is a natural hormone and we are allowed to choose as patients. There's some guidelines called shared decision making. So even if there's uncertainty or there is risks, as long as you're aware of those, you can still consider continuing a treatment. When people are on the right dose of testosterone, their risk of side effects is very, very low, and it doesn't seem that their risk increases the longer they're on it. The testosterone only works the day that you use it anyway. It doesn't build up in your body, so you shouldn't be taken off it after a certain length of time at all. How long do symptoms last from perimenopause to postmenopause? Well, that really varies actually. Everyone is really different, and some people find that symptoms can persist. Some people find that symptoms change. So they might start off having some flushes and sweats, then they might find that they have mood changes or sleep interruptions, or they might then get pins and needles, or headaches or palpitations. So not everyone has every symptom, and some people, like I say, have a collection of symptoms, or some people might just have the odd 1 or 2 symptoms. When you look at the studies, perimenopause can last around 10 years, so that's around 10 years before periods stop. And the menopausal symptoms, when you read the articles, say on average it's about 7 years, but I've certainly seen women who've had symptoms for decades. I saw a woman recently in the clinic who'd had a hysterectomy when she was 43, and she's now 75 and she still has symptoms. Every night she wakes up drenched, and she has lots of other physical and mental health symptoms as well. So it really varies. But it's not about trying to get through it, because once we're menopausal, we're always menopausal. Those hormones will be low forever. And there are 2 reasons that we address them by taking HRT. One is to improve symptoms. Of course, we want people to feel better. But the second thing is to improve our future health. We know taking hormones reduces the risk of diseases. And so when we have a lower risk of heart disease, osteoporosis, diabetes, even some studies have shown dementia as well, we reduce inflammation in our body. It helps us to keep healthy, and we want to stay healthy as well. A lot of people say, well, I don't have any symptoms of menopause, but actually when they do take HRT, they find that a lot of symptoms that they've just attributed to getting older or just due to life have really improved. And that's why it's so difficult to actually make the diagnosis often, because it's not just a certain symptom or a certain type of symptom. If you download Balance app and monitor your symptoms, you'll see there's lots and lots of symptoms that we've added, which make it easier to build up this bigger picture really as to what's going on. So thank you very much for all your questions. If you enjoy the question and answer sort of freestyle format, then let me know. I'll post this on my grid. If you've got ideas for other topics that you'd like me to cover, then please do that. And in the meantime, go to my YouTube and look at ones that I've done in the past, and obviously download my podcast every week, because I've got some amazing episodes lined up, as well as having done some fabulous ones in the past. So enjoy the rest of your Sunday, and have a great week.